In a seaside coach park, paramedic Andy is setting up an operating theatre so Dr. Chris and the team can put a critically ill patient into an induced coma.
Right then, are we happy?
Yeah.
So on move, ready, steady, move.
Let's get him set up so it's right underneath him. Have we got any more? Like that?
Coast Guards are protecting patient Daniel's privacy from passing tourists.
Right, now let's just slow him back slowly. See what he's like.
He owes his life to lifeguards and his auntie, who saw him go down.
We were just out for a family day out. We were just wandering up the promenade, and then we just heard a commotion, and he was on the floor having some sort of seizure. He sort of landed in the recovery position, and he was responding to us and saying he was fine.
So we're just going to lift the patient, okay? Ready, steady, lift. Thank you.
And then he just seemed to go into some just cardiac arrest, I guess, so we had to get him on his back, and he had stopped breathing.
I know it seems fussy, but getting his position is going to be crucial to sort his airway out.
And then eventually the ambulance came, so they had to give him compressions and just worked on him with CPR for quite a while, really. And yeah, now here we are.
Okay. Right, guys, so what we're going to do now is just a quick checklist, and then we're going to get this guy off to sleep, okay? So this is an emergency anaesthetic in the street. It is a bit risky, but it's what he needs, okay? So, ready, good to go?
Dr. Chris and the team will first sedate Daniel, then take over his breathing.
So, Lee, he's probably at 150 kilos.
His size means he'll need bigger drug doses, and putting a tube down his windpipe could be very difficult.
So team brief is, this guy is pretty big, so he's going to be difficult airway. So plan A is going to be to intubate him. Plan B will be to go back to this eye gel and then do something different for the second attempt. Plan C will be front and neck access, which I can feel, but he's big. Okay? Everyone happy with that? Should we get started?
Checklist complete.
So silence unless it's a safety thing, please. Okay? Okay, fentanyl's going in. So all but 1 mil. Good. Andy, you're going to time a minute for us?
This is a complex procedure. Daniel's life is in their hands now.
Okay, so the patient is going to stop breathing and become flat unconscious. That is supposed to happen, okay? Okay, so that's a 99. That's 1 minute. Okay, fingers on for me if you can, please, Lee. Scope right into the hand, please. Lots and lots of secretions. Got a big epiglottis. I've got a grade 2 view. Bougie, please.
It's time to slide the tube into his airway.
Keep it down, is that somebody?
Yeah, 99.
I can feel the clicks. I've got the bougie. I have the tube's going down. Little rotation through. 22. Bougie out, please. Cuffs up. Slats are still 99. So the chest is going up and down. I've got CO2. You have to have a quick listen, Lee. Okay, you can stand easy and talk as you do now.
Daniel needs cardiac specialists to identify the cause of his arrest. Lee is talking to the nearest heart unit in Hull.
Originally, ECG was quite indicative of an ST elevation MI. That was done at 16, 17, but his subsequent ECGs don't really demonstrate it. So it could be he's got some underlying abnormalities with his conduction to his heart, and obviously with his previous, it would sort of tie in.
So hands on the scoop, lifting, so feeding down, empty. Can you give her 1 mil of that?
Daniel's condition is critical. The team will be monitoring his heart function throughout the flight.
So, just a quick break, says, numbers-wise, airways, we're happy with this tube, it's secure, we've cuffed, we've checked the pressure, we've suctioned the tube, we've checked the circuit, and we're happy with that. Okay. Cardiovascularly stable, blood pressure's fine with a bit of a tramadol. Right, happy for me to start? Yes.
It's a 30-mile flight south to Hull and the nearest cardiac unit.
We'll go along the grass so that if we have an event, we can actually put it down there.
So it sounds like this chap's had a cardiac arrest on the street of Bridlington. We don't really know why. He's got some bit of cardiac history, but that's many years ago. He's a really big guy. So he does have some risk factors for having kind of a bit of ischemic heart disease. When we arrived, he wasn't breathing very well, he was unconscious, so we decided to give him an anaesthetic, which I would say was a riskier thing to do, but because of his size and the obesity, The risk is that you could struggle to get a tube in. However, we put lots of care to prepare that correctly, and fortunately, because of that preparation, it was straightforward. So we're just getting him in now to Castle Hill, which is the cardiac centre for this region, and we should be there in about 5 minutes.
Daniel's survival is in real doubt. His collapse at such a young age is a mystery. Every year, the air ambulance team fly to Germany for a grueling